So, since Florida has decided to attack vaccinations, we have seen an increase in pertussis in the state. In fact, we've seen an 81% increase this year over last year. So, what is pertussis? Well, pertussis, or as it's more colloquially known, whooping cough, is a extremely contagious bacterial infection of the lungs. 1 out of 5 babies will develop pneumonia from it, and infants can also get seizures and brain swelling from this disease. It used to be highly fatal for children. It is completely preventable using vaccinations today, but the anti-vax movement have caused these cases to increase across the country, and Florida is seeing an 81% increase right now. So how contagious is pertussis? Well, the answer is extremely. So pertussis is a very extremely contagious disease. It ranks right up there with measles. Let's talk about it. To understand how contagious a disease is, we have to understand 2 factors. The first is the R0 value, and the second is generation time. Let's start with R0. So R0 is a simple equation that looks at how many people a single infected person can infect over the course of their disease. So pertussis has an R0 value of 15 to 17, meaning one single person who has it will pass that disease to 15 to 17 other people. So for a contrast, polio has a R0 value of 4 to 6, meaning a person with polio will infect 4 to 6 other people. And measles has a R0 value of 16 to 18, meaning it's more contagious than pertussis, but not by much. Now, the other factor that has to be considered in order to determine how infectious a disease is called generation time. Basically, this boils down to how long before an infected person becomes contagious and can pass that disease on to someone else. So with the bacteria that causes pertussis, this could be between 1 and 3 weeks. So we'll say 2 weeks on average, which is about the same as measles, which is 12 to 14 days. So they are both super contagious within 2 weeks of exposure. Now, both of these factors are used to help calculate herd immunity. So how many people in a population have to be vaccinated for a disease to prevent that disease from spreading? With pertussis, you need between 90 and 94% of the population to be vaccinated for that disease to prevent it from spreading to the larger population. With measles, you need about 95%. So they're both highly infectious, and they require a lot of people to be vaccinated who can be vaccinated in order to prevent this disease from spreading. Diseases like pertussis and measles are easily preventable through vaccination. However, due to the influence of these anti-science movements, states like Florida have stopped listening to experts on public health and vaccination in favor of the podcasters and charlatans who push those anti-science agendas. And our children are paying the price because of it.